I have several hobbies, singing in choir, traveling, but most of all I like the gardening, and the garden is my pride and joy. My disease started 25 years ago with pain in the hand and the feet. I tried to ignore it because I'm a doctor myself, but eventually I have to go to a colleague that gave me the diagnosis rheumatism. My disease has been quite severe, so I have had the strongest drugs from the beginning. It was a new life that began. Unfortunately, it didn't last. It has been ups and downs over the years, but still it's much better after the new biological medicines. They are more effective, but still I have to change between drugs, and now I'm on my fourth biological drug. Nowadays I work together with my doctor and the computer for every change in the treatment. I can check my chronic disease at home in between visits. Before I go to see my doctor, I measure my own health. It's easy, I just click on the screen and enter how I feel now.
More and more doctors use national measures from the registry. Today, 25,000 visits per year are reported directly from the clinic to the quality register in rheumatology. When Karin visits me at the clinic, I access the information that she has entered at home. The quality registry uses nationally agreed outcome measures. I can also compare my results with other clinics and also with the best in Sweden. I have invited Karin to use these measures, and she gives me information on how she's doing and the effects and the side effects of the medication.
The internet support system enables me to contribute the management of my own disease. I can monitor the effects of the drugs, how they help me and if they failed. I can better understand my doctor's reasoning when we decide on my medication and how I should take it to get the best result. Now I'm doing fairly well, but we can see together when the disease becomes more active and I need a new drug.
The new drugs are so expensive that there are always questions about the rising costs. I feel confident that the drugs are used in the best way, since I can measure the effects all the time in every patient and at every visit.
Now I have a system to help me take control over the situation. I can use it to compare how it is now and how it has been before. The other day I told my husband I've never been as bad in my disease, but he didn't agree. And we looked together on the data at the internet and realized that I've been worse before. This helps me get through bad periods by myself, since I know I've managed it before. The future is bright. Here in the spring the garden is wonderful and I can work in it. We are soon leaving for a 3-month trip through Europe, and that is a dream of our life. And that hasn't been possible before the new medication.